Good afternoon, and good morning, where you may be. And welcome to Advocating for Policy Change to Support Expansion of Broadband Access, brought to you today by the Georgia Geographic Health Equity Alliance, Nutris Voces Adelante, and the Self-Made Health Network. The three networks that comprise the Tri-Networks Cancer Prevention Community of Practice. We will be starting shortly, so please introduce yourself in the chat by sharing your name and where you are joining us from today. I see we have California and Georgia, so don't forget, take a moment, introduce yourself in the chat by sharing your name and where you are joining us from today. So, good morning and good afternoon to some. I am Shanta Chambers from the Self-Made Health Network, and I am so excited to welcome you to the second installment of our webinar series, Advocating for Policy Change to Support Expansion of Broadband Access, hosted by the Tri-Network Cancer Prevention Community of Practice. I am thrilled to see so many eager participants joining us today from all over the place. So thank you so much for taking time out of your afternoon to be with us. So without further ado, let's dive right into today's webinar. So a few housekeeping. So let's go a few important housekeeping details. So all participants are muted by default. So please use the chat box for general comments. If time permits, we will have a dedicated Q&A session at the end of the presentation. If you have any specific questions for the presenter, please use the Q&A box. Remember, use the Q&A box for your questions and the chat box just for general comment. So as our presenter goes through the presentation today, make sure you're writing those questions down so we can have a very robust Q&A session at the end. During this session, you will see a QR code at the end to submit your evaluation survey. This is so critically important because we use your evaluation feedback and those results to really help inform future programming. You will also receive a post-webinar email containing the recording, slides, and again, that evaluation survey. So please don't underestimate how invaluable your feedback is to us. And again, thank you for joining us today. So I want to take a moment to provide you a brief overview of the Tri-Network Cancer Prevention Community of Practice. So the Tri-Network Cancer Prevention Community of Practice is a collaborative effort between three CDC-funded national networks focused on addressing cancer and tobacco-related disparities. Those networks are the Geographic Health Equity Alliance, also known as GEA, Nutris Voces Adelante Network, and of course, Self-Made Health Network, which I represent today. Our goal with the Tri-Networks Cancer Community of Practice is to enhance the capability of national comprehensive cancer control programs, cancer coalitions, and allied partners in implementing policy, systems, and environmental change strategies that target the root causes of health disparities leading to increased cancer rates. The Tri-Networks Cancer Community of Practice aims to bolster interventions that address the needs of underserved populations, including those with low socioeconomic status, Hispanic, Latino communities, and those geographically defined groups. Our focus areas revolve around four distinct priority topics. Those are HPV vaccination for cancer prevention, improving the built environment and physical activity, ensuring food and nutritional security, and today's focus, of course, expanding access to broadband. Next slide. You are truly in for a treat today. We have Dr. Whitney Zahn. Dr. Whitney Zahn is an assistant professor at the University of Iowa's Department of Health Management and Policy, and she's also a full member of the Holden Comprehensive Cancer Center. Her research employs health services research, social, epidemiological, and spatial methods to address rural cancer disparities across the cancer continuum and to evaluate access to healthcare services. She has a particular interest in reducing cancer disparities among rural minority populations. Dr. Zahn leads the university's Advancing Cancer and Rural Equity Lab. So she's truly an expert in this space. She also serves on the board of the Iowa Rural Health Association and co-chairs the Cancer Prevention and Control Research Network Rural Cancer Work Group. So join me with a virtual round of applause and welcome our presenter for this afternoon, Dr. Zahn. The floor is yours.
Right. Well, thank you so much, Shanta, for that very, very kind introduction. And I'm glad to be here with you all today virtually. And I think that fits well with our focus on broadband because we're all accessing broadband at this very moment to participate in this webinar. So I am sharing my screen here and we'll share my slides. Probably make sure that there we go. Yeah, so thank you very much for that introduction and for being here. And I'm going to be talking about policy change and expanding broadband access. And this is an area when we think about cancer and addressing cancer across the continuum where it may not seem the same as we think about last time with you all talking about HPV vaccination that really has a direct prevention opportunity for cancer. But broadband, as we've, I think, particularly identified over the past 4 years with the pandemic, just how important broadband access is to so many different aspects of our lives, including addressing cancer disparities across the continuum of care. So today I'm going to present some information that hopefully helps you in your coalitions, whether it's at the state level or local levels or your organizations, to think about the role that broadband access can play in cancer prevention and control, the types of data that you can use in advocating for policy change, or just to gain awareness of how a lot of the increased resources for broadband access have been distributed and how you could leverage those resources or advocate for expansion or allocation of those resources. And then to think about policy levers and partners that are important for broadband access purposes. So I'm going to start off with just some broadband basics. Obviously, I think we are all really familiar with, we've all really used broadband quite extensively, as I noted just today in being part of this presentation, being able to, use something like a platform like Zoom that requires those high internet speeds to be able to use. So just some basics here. Is historically the way that broadband has been defined has been based upon download and upload speed capabilities. And for the most part, over the last several years, that benchmark has been 12 megabytes per second download and 3 megabytes per second upload speed. So to think about what that tangibly means, if you are uploading a video to YouTube, for example, that is around 40 megabytes, that speed would need to be, that speed would amount to that upload taking just under 2 minutes to occur. With the advancements in broadband and a lot of efforts around that, just last week, the benchmark has increased to define that broadband speed to be 100 megabytes per second download and 20 megabytes per second upload speeds. So to put that again into that perspective, what that tangibly means as we use the internet, and broadband specifically is for that same 5-minute video, YouTube video that's 40 megabytes in size. That would mean you can upload it in 16 seconds. So there's been some changes. A lot of what I'll be talking about will be reflective of the historical definition, because as I was preparing this slide, I ran across the information linked here about that increased benchmark that was just put into place just this month. So that's kind of defining broadband, but when we think about that in practice and what that means for us on a day-to-day basis, is there's a phrase that the former head of the FCC, the Federal Communications Commission, or I should say an official with that that entity within the federal government, she called it a super determinant of health. And so if we think about the goal of this collaborative effort in GIA and the other organizations involved about thinking about those upstream factors, we often talk about the social determinants of health, but as active as a role that broadband plays in all of this, it's been framed as that super determinant of health. When we think about how important it is for so many elements of people's lives, whether that's accessing information online, whether that's accessing, for example, signing up for health insurance, that can be, or other resources, or education, participating in online classes. We saw that with the pandemic, or so many elements of that can be, being participating in a virtual visit with a provider. That can be, so many of us now working from home or working in hybrid environments. We need that residential broadband access, not just that broadband access that is available through our employer. And we think about those social determinants of health, like employment, like income, like education, like access to care. All of those can be facilitated by having strong access to broadband. When we think about, again, those hybrid jobs or working from home, or those kinds of things, those can be really, really important. So I think I just really like that characterization of broadband access when we think about all those ways that it facilitates health. And I'll speak in a moment more specifically to how we think about that in a cancer context. So how does it vary across locations and populations? And some of my colleagues and I did a study a couple years ago looking at broadband access across the continental or the contiguous United States. And we analyzed some data from the American Community Survey at the census tract level, and I'll talk more about that data a little bit later as a resource. But I just wanted to highlight some of the things, and this is broadband access in the sense of surveying people and asking, do you have broadband access? So it's not just saying, an internet provider saying, yes, we provide broadband access to people living in this area. It's actually, are they using broadband? Do they have that at their home? And we did some spatial analysis, as you can see here, where I'll particularly highlight the places in blue. Those are areas where there are geographic clusters of low access to broadband. And we can see that, every state has that to some extent. It has low access, clusters of low access, and as well as some clusters of higher access in most places. But we can see, throughout particularly the South, parts of the Southwest, as well as parts of the Dakotas, Montana, northern Minnesota, northern Maine, very rural areas tend to have clusters of that low access to broadband. We see when we look at the characteristics of those areas as far as their demographic composition, those areas tend to be more rural, have higher percentages of Black, Hispanic, or American and Alaska Native populations, and also have higher percentages of people who are living in poverty in these areas with high broadband access. So when we think about some of those intersections with cancer disparities, we see some similarities when we look at some of the epidemiology of cancer in the United States, where some of those rates of cancers or those higher rates of mortality or greater cancer burden tend to be amongst these same populations that we see who have low access to broadband. So those are important things to consider. So thinking about broadband access in cancer care, and when I say cancer care, I mean that kind of across the continuum of care, whether that's preventative services through survivorship services. There's really an important role that broadband access can play in facilitating a lot of things. And I want to note this has been something that has been emphasized for several years as an important aspect of cancer care. So just to provide an example of some of this earlier efforts is the President's Cancer Panel report from 2016, which focused on, in part, on improving cancer-related outcomes with connected health. So that role of broadband and other pieces of health information technology that can play a role with the specific objective around facilitating health information access and sharing through ensuring adequate internet access. So some of the things that have come from that is cancer collaboration from FCC, the Federal Communications Commission, and NCI. And this is kind of their model and the things that they were focused on: surveillance, risk reduction, research, and cancer care. And so that can tie into all these goals or objectives around reducing cancer burden, improving care experience, and workforce satisfaction in providing care. So those are all things that we can see coming from this focus area on related to internet access or broadband access in cancer care. So thinking about how this might work, or how we might see broadband access related to a role in cancer care. A couple of things I want to highlight is where do we see this happening? One is simply access to cancer-related information. And this can be true of people who are looking for information on healthier lifestyle habits around physical activity or nutrition. There are some of those other areas that this network or collaborative effort is focused on, in addition to broadband access and HPV vaccination. That can include that kind of cancer-related information, that smoking cessation, all sorts of things. That can include information around cancer screening, include information around, if you're diagnosed with cancer, connecting with information that might help through that process and deciding, making treatment decisions, understanding the symptoms of the side effects or symptoms related to cancer treatment, or it could be related to survivorship or connecting with survivorship groups or other sources of information. And then there's a study from Fareed and colleagues noted here at the bottom, where they identified, looking at cancer data from the Health Information National Trend Survey that I'll speak to a little bit later on, where they found data through 2018 that consistently roughly 80% of cancer survivors accessed cancer information, excuse me, online. And while that those data are 6 years old at the newest, we see that even looking that far back, a high percentage of cancer survivors are really trying to seek that information through the internet, and that likely is higher now, I would assume, with any analyses of newer data. So that's a really important thing, to make sure people can access that information. A second piece, and we saw this particularly during the early phases of the pandemic, is a telehealth virtual visit. So another study looked at that early phase of the pandemic, particularly January through April of 2020, and half of cancer patients during that time had a telehealth visit. So obviously that might have leveled off a little bit, or decreased now, where we're a little bit further out from the more acute phase of COVID. But obviously that's still something that can be a really effective way to make sure patients get the care that they need, the follow-up that they need. And you think about that particularly with cancer patients who may be more susceptible to infectious disease, the immune compromised state that cancer patients can be in this new normal we're in, and maybe being more more attuned to that element, that, having people being able to access that care, that follow-up, through telehealth can help protect patients. Another key thing is remote patient monitoring, or mHealth, some of those mobile apps that people could use, where having broadband access available and being able to use those more easily can be really helpful for cancer patients. And some systematic reviews have shown, for example, symptom tracking or medication tracking is something that these mHealth apps can be helpful for. Remote patient monitoring, often we see that for things like blood pressure, other things, but it can be helpful in thinking about for cancer patients as well. Patient portal access. We know that cancer patients and survivors may use portals to access lab results or other things. Maybe it's accessing, the results of screening. Um, uh, Somebody had a colonoscopy, you might be able to access those results there. There's also the important element of making sure patients have the information to interpret those findings and make sure that that information is available in a format or at a level that is understandable for the everyday person who doesn't have an MD or DO or other kinds of health training to understand that. And then a final way I'll note too is this Project Echo model that is used quite a bit in a lot of different treating a lot of different kinds of health conditions, but increasingly NCI and the American Cancer Society also have efforts around Project Echo, which is this hub and spoke knowledge sharing network to do virtual clinics between primary care and specialists. So that enables these primary care providers to connect with specialists and have those conversations on knowing how best to support and provide care for their patients directly. And so that's going to be needed. We think about care in rural areas and even at a clinic or elsewhere where you have that provider, making sure that broadband access is available for those individuals. So just want to kind of share kind of the wide range of the importance of broadband access, specifically tied to telehealth and other elements, but also in accessing health information, access, whether that's websites, whether that's a patient portal or other things, just to present some of those examples as we go forward in thinking about this. So if you're thinking about your coalitions and thinking about where do I find information on broadband access or resources to expand broadband access, I'm going to share some of those that might be helpful for you, and then talk later on about some of those policies and how we can tie that data to those potential policy levers that might be something to consider in advocating for policy change. So I noted earlier the Health Information National Trends Survey. This is a survey that's regularly conducted by the National Cancer Institute, focused on a lot of cancer-related topics, but particularly focused on accessing health information. And so some of those that I note here are some of the ones that might be most relevant, thinking about broadband access or access to services that rely on broadband. And so that includes, they ask questions about individuals' broadband access, specifically, like back up a minute, this survey is conducted amongst the broader population, but also has variables around cancer survivors. So you're able to make some distinctions between, the broader population, but also can narrow it down to those who have been diagnosed with cancer, if you want to explore that further. So the questions focus around broadband access, use of telehealth, that can be virtual visits, mHealth, remote patient monitoring, use of the internet for accessing cancer information, and trust in the information from different sources. So that includes internet-based sources. So those data are readily available to download for free if you have the resources or capabilities to do those analyses. But they also have a wide variety of briefs focused on analyzing some of those data. I have a screenshot of one of those here that look at the patterns and predictors of telehealth use. in 2022. So that can provide some national level data that might be helpful to be able to share with people. And I've linked directly to all those briefs that they have available. That might be something that you can look into in thinking about, where do we find this information? Maybe that's to support the development of your comprehensive cancer control plan. Maybe that's in thinking about other kinds of things you're developing as part of your coalitions or organizations. When you think about broadband access data, I've linked here a couple of different options. The American Community Survey, this is what we used in the study that I mentioned earlier. And this enables people to look at broadband adoption at different geographic levels, state level, county, census tract, et cetera. And this one really focuses on this idea of broadband adoption or broadband access, in the sense of not solely is there a internet service provider in your area who's providing service, but do people actually have access to broadband? Because when we think about access to broadband, although it's focused a lot on that element of, is it available? It's also important to think about, do people have the resources to buy a computer or a tablet or a smartphone, and also to pay that monthly subscription fee. So when we think about access to broadband, there's that element of accessing that service in that capacity. And that's, I think, an advantage of the American Community Survey data over some of the data from the Federal Communications Commission National Broadband Map. So that's still a very, very important resource, but it is pulled from broadband access providers in what they report versus what the public reports on. Are they using internet in their home, or do they have that subscription? But the FCC maps, you can click on these and look at the service types, so you're better able to narrow it down by residential service or business services, fixed or mobile technology. So thinking about broadband access for mobile phones versus kind of that fixed in our homes. And then also speed. So there's some information there on the broadband speed. I noted earlier that shift in that kind of benchmark on broadband, but you're able to look at that a little bit more detail as well. There's some other sources of data around broadband speed, because that's an important element too when we think about this. Is not solely are there providers, not solely do people have access in their homes through a subscription, but also is that speed consistent? What does that look like? Because we all know if that speed isn't right, we get unstable. Internet service. That's probably all happened to us at one point or another. I know it's happened to me, even sitting in a university office where I have this message that broadband connection is unstable. So speed plays an important role there. So you're able to explore that through this Broadband Now website. That can help understand what's the number of internet service providers in your area. So that might be of interest in thinking about, okay, we have this, one provider in our area, but if they're the sole provider of internet services, maybe that makes them, where they essentially have a monopoly, and that makes it more expensive for the community. So thinking about what's available there, what are the minimum and maximum speeds, and what kinds of services are available. So in the broadband space, fiber networks provide the most stable and fastest speeds, but installing the infrastructure around that means it's not quite available everywhere yet. And so you can kind of get a sense of that, and maybe that's promoting resources to be able to provide that fiber infrastructure as well. So that particular website enables you to drill down and look at that mapped in your community. The National Telecommunications Information Administration, part of the federal government, has also some public GIS data on a variety of different resources or grant programs, and seeing where has that been deployed. So they have this broken down. Some of these are newer programs, so they don't have data for like the BEAD program and the Digital Equity Program, I believe. But this gets into some of the resources. As you may have seen over the last 4 years, the federal government has invested a lot of money, as well as state governments, in expanding broadband access, and that includes a lot of grant programs and other resources. And so this will enable you to dig down into some of these data sources, whether it's connecting minority communities, tribal access to data, and you could see, in the map I shared earlier, parts of South Dakota, for example, where we have a lot of um, uh, reservations and other tribal organizations that there's low access there, and so there's this resources around that. As well as where has funding been deployed around broadband infrastructure, and that includes also that middle mile characterization of kind of that in between part of connecting between those providers and the individuals accessing that, as well as a variety of other things that you can explore further there. But that can be helpful in thinking about from the policy perspective. Um, you know, this may have been deployed. There might be the resources may be deployed. There might be federal funding, but has that gotten to people who might need it the most, or parts of your state, or whatever it may be, and thinking about that. And of course, I always want to know the kind of the data that you may be able to explore in your coalitions, in your organizations, that may not be those publicly available traditional quantitative data. But I think it's really important to think about, if this is something you want to pursue in thinking about this. There's a lot of different groups to engage: cancer patients, cancer survivors. I was tended to say caregivers rather than patients again, but caregivers, providers, having those conversations with those individuals, whether it's a key informant interview, a listening session, a focus group, in thinking about how have patients used, how has broadband helped patients, whether that has been those virtual visits, whether that has been use of patient portals or mHealth technologies, or how has that improved provider satisfaction, tying back to some of the goals or the objectives from the president's cancer panel several years ago. So those are ways you can solicit that feedback to understand, what have been what barriers have people experienced in accessing telehealth, for example, or what has enabled them to be able to do that. So there's maybe been some programs that have provided a tablet to individuals, or a resource, wearable technology, maybe somebody who's wanting to track their steps as a cancer survivor, and helping them to continue to maintain a good quality of life. What has been that facilitator for them, and maybe it's a wearable technology that they then sync their watch, and I'm showing mine on the camera here, how many steps have I walked today, or whatever it may be. So those are just some examples, that I always try to highlight. We have all these, resources that are available at the federal level or the state level, but if we have the capacity to do so, some of these stories or these qualitative feedback through interviews or other sessions, other approaches, may be really impactful as well. And in a similar vein, I think there are stories that we can think about, anecdotes that are always important to marry with that quantitative data, those maps, those charts, that can be really impactful. So when I think about this, kind of tying back to our experience in the pandemic, one of the things that really resonated, I think struck me, and I remember this happening in the early stages of the pandemic, is these examples of, and this is a picture here on the left, these are some children that had gone and they're sitting outside a Taco Bell that had Wi-Fi broadband access, because they didn't have that access at home, and so had to go somewhere to get access to do their homework, because school was virtual at that time. So that might not necessarily be a directly cancer relevant example, but there might be other situations where maybe somebody had to drive to somewhere during the pandemic to have that virtual visit with their provider. Maybe drive to somewhere that had broadband access. Or I'll talk later about the partnerships where we see libraries playing an important part of providing, facilitating broadband access. So, I share that as an example or a story that maybe we saw on the news, and maybe there's some stories about cancer patients or cancer survivors and their access to broadband. that may really emphasize that importance and that need for broadband access. And we see, you know, some innovative ways to solve some of those problems, those challenges. So as another example, I know places throughout the country um, equipped, school buses with Wi-Fi internet access to enable kind of address those challenges. So children weren't sitting and, right outside a Taco Bell so they could access broadband. So maybe there's some, cancer relevant examples, but those are some, I think, just thinking of those impactful stories and those interviews or those focus groups or those listening sessions that you may be able to do as part of your coalitions or as you develop your comprehensive cancer plans. Those might be some avenues to consider. So in thinking about policy levers and partners, I just want to talk through some of those examples. And, I've introduced the ideas of, reminders on what is broadband, what does that mean? How can that be relevant for cancer? What, and cancer prevention through cancer survivorship. I want to talk a little bit about these policy levers. So we think at the federal level, there's some really key ways we think about funding. One is the infrastructure piece, making sure there's that there's fiber wiring, all of the infrastructure. Then there's also thinking about funding for adoption. So there's been some federal programs that have provided support for low-income individuals to pay for their broadband subscription. So, whether it's advocating for those programs to continue or advocating on the infrastructure side, both of those are really important because we can have all the infrastructure in the world, but if people don't have the money to pay for their broadband subscription every month, that becomes a challenge. Much in the same way when we think about healthcare, we could have hospitals or clinics in every corner, but if people don't have insurance to cover that or other ways, it's not truly accessible. Other important things are measurement and mapping of broadband access. So there's the BEAD program that I alluded to earlier, and I linked some more information here. And making sure that that data is accurate and up to date, because that ties to how much federal funding states will get to expand internet services. So one of the things, as I noted, there is some limitations to the FCC maps, but that is something that the FCC has really made efforts to improve. And there's continued efforts going forward on an annual basis, looking at that broadband map, making sure that that accurately reflects broadband access in each state. Because if it doesn't accurately reflect it, then there might be potential for states to miss out on federal funding because it's not an accurate representation of the access available there. Some other things just to note is all the federal agencies that have been involved, whether it's grant programs, other kinds of programs in thinking about broadband access. And I realize here I didn't put NCI, but NCI, as I noted here, I just pulled a lot of this from the Broadband USA website, and then a GAO report, which is where this bottom chart comes from. But we can see, a lot of federal agencies involved in, there's other, whether those federal agencies, but also thinking about regional commissions. So for example, the Delta Regional Authority, which runs from Southern Illinois down the Mississippi River, Southern Illinois, Western Kentucky, Southeast Missouri, on down the Mississippi River to include parts of Arkansas, Tennessee, Mississippi, Louisiana, and then, even though not adjacent to the Mississippi River as well, also includes some counties in Alabama. So this is a regional commission. It's very rural, has a high proportion of minoritized populations. And so they have made an effort as part of the DRA to map broadband access. And so kind of crowdsourcing that information and seeing, from your address, what is the speed? And there's ways to test that. So that's just an example of some of the ways thinking, more at a federal level, but thinking about, if your state is part of the DRA, are there ways to connect with that authority and thinking about that? Because there's a lot of funding available, or some funding available to expand broadband through thinking about that context of the these regional commissions or authorities. That includes Appalachia, that includes the Delta Regional Authority. There's the Northern Border Commission. I believe there's some related to areas of Alaska as well. So just to give some examples. And thinking at a state level, I think there's a whole host of levers to think about that I'll just highlight here. And there's a really nice resource I have linked at the bottom from the National Conference of State Legislatures, where they track this and update this monthly on what are the policies at the state level around all these areas that I have listed here. And so you're able to see, what is your state doing? I'll just kind of highlight some of these and thinking about this. One is this idea of preemption laws and how that might tie to municipal broadband networks. So some states have what's called preemption, which means that state laws preempt anything, I should say anything, but may preempt local level local level policies or other things. And when you get into municipal broadband networks or cities or towns or counties or smaller units than state, they might get into some of these municipal efforts to improve broadband in their areas. But these states here on in yellow on the left, they have preemption laws where there might be some things that prohibit those more localized efforts based upon what the state does. There's a lot of other policy levers around expanding, access in various capacities, education in schools when we think about broadband access, expanding infrastructure, mapping of those services and how that ties into some of those federal resources that I mentioned, service mapping, as well, funding and taxes, how is this paid for, from that perspective. Net neutrality, so that is a concept that focuses around this idea of who gets prioritized when we think about speed of broadband. And so there can be areas, there can be an approach to this idea of net neutrality where maybe larger businesses or certain organizations or certain entities may get, kind of first priority for that faster broadband, and residents, everyday people may not get that. So anyway, there's a lot of discussion around this idea of net neutrality and should there be, that prioritization of faster speed. Of course, provider and consumer relations is a key thing, thinking about all the internet service providers and the dynamics and relationship with the everyday consumer. And then there's a lot of discussion around this idea of governance. So a lot of states will have a state broadband office. Some might not have that specific office, but they might have, efforts around broadband that are housed within some kind of office within the state. So thinking about, the governance role and how that might be done at the state level. And again, you can explore that a little bit further in the link listed below. But those are some things to think about and in ways that could advocate or think about for expanding broadband access through a lot of different avenues. And thinking about partners, I noted state broadband offices. And again, your state, where I'm sitting in Iowa, we don't have a state broadband office, but we have an entity within another office that focuses on broadband efforts. Utility companies, there might be avenues to think about through that, and that includes internet service providers, library associations. So some of the big promoters of broadband access expansion are libraries. And again, we saw that a lot, particularly during the early phases of the pandemic, where that can be a source of broadband, a place to get access to broadband. But that is an example, and we see that here on the right. Your extension offices will have some information. So thinking kind of in the agricultural space, and also farm bureaus are some other potential partners, particularly in thinking about that rural access to broadband. There's some information linked here on potential approaches to public-private partnerships. So it's really ones I think many promote for this idea of expanding broadband, because it's so focused on a specific industry and the internet service provision. And so What I have linked there are some resources in how to approach those partnerships or how to engage those private organizations in that process. And these are just some examples. You may think of others. And I think it's also important, with this not being a direct cancer specific type of resource or um, uh, they're being creative about thinking about who else might be of interest. Maybe it's thinking about other kinds of health organizations for whom broadband access is going to be important. Think about cancer, but we can also think about maybe there's American Heart Association chapters and thinking, for example, about the role of remote patient monitoring for blood pressure. Anyway, there's a whole host of other health conditions or areas that for which broadband access is going to be very important. So again, just want to leave you with some key, just broad conceptual takeaways in considering one that obviously in a challenging policy environment, and there's been a rapid influx of these funds into broadband expansion, and we see that represented in some of those maps that I introduced or linked with seeing where some of those programs or resources have become available. And so those are some things to consider. Also, the use of data and stories to advocate for policy change can be really important. Those maps, or where do we see broadband access, and then also what are some policies that we can advocate for, as well as the importance of partnerships, whether it's developing new partners, engaging new organizations or entities in your cancer plan development or other avenues who might be important. Say if you want to develop a goal, objective, or strategy around broadband access as part of your comprehensive cancer control plan development, you may want to engage some of those new partners who you haven't engaged before as part of this, and that can maybe really help move the needle or advance things in the area of broadband access. So that is all I have for today. But I certainly I think we have some time for some questions. So I'm happy to try to address those. And of course, you can reach out to me later on via email. My email address is listed on the screen. Otherwise, I thank you very much for your time and attention, and happy to take any questions.
So please join me in giving a virtual applause to our phenomenal speaker this afternoon, Dr. Zahn. So use your reaction button to send her those applause. And thank you so much, Dr. Zahn. Another just amazing and informative presentation. So to our participants, don't forget to use the Q&A function to pose your questions, and we'll begin to take those questions now. The first question, Dr. Zahn, is, has anyone done anything to improve rural health? So that's coming from one of our participants.
Yeah, and if that participant, I'll answer that question as best I can. But if there's like a specific element that you're most interested in, please feel free to add that to your question. I'd be happy to try to expand as well. But there are a lot of folks really trying to improve rural health in many capacities. Our healthcare providers are working in those capacities to improve rural health. There's a lot of thinking at speaking more to the policy space. There is a great National Rural Health Association at the national level doing a lot of great work on promoting policies that will help rural health. That can include expanding access to rural health, increasing the workforce, making sure there's more favorable reimbursement policies so that those rural hospitals and healthcare providers can remain financially viable and stay open so they can provide care. There's a lot of efforts on the economic development side, because as we know that in order to have healthy communities, you need to have communities with education, with jobs, with all of those things. The National Rural Health Association does a lot of work in, sharing those best practices from people working in those areas. So there's certainly that. I'm biased. I work for part of a rural health research center. So HRSA um, has funds. I think there's about 8 rural health research centers throughout the country, and we aim to do a lot of work on trying to see those best practices, analyze the data to help us understand specific areas where we can improve. You know, I see a lot of excitement, engagement in our students who are interested in going into rural health. So there's certainly a lot of, you know, while rural populations are getting older, there's still a lot of people who are younger who want to maintain, those rural communities. So I know there's students, including here at the University of Iowa, really focused on that. So yeah, there's certainly a lot of areas, and I could speak to a lot more, but I also can speak more specifically if there is um, a specific element of rural health that that participant wants me to speak to.
So we definitely invite that participant who posed that question. If you want to add some more specificity, then that would be greatly welcomed. In the meantime, Dr. Zahn, one of the slides you presented to us was a list of all these different entities that we can think about in terms of partnering around broadband access. Who are some of those partners that you would really elevate in terms that we should really think about engaging
Hmm.
in these types of efforts?
Yeah, yeah, great question. Let me go. Oops, I meant to go back to that just so I could have that. Yeah, I think any of those can be particularly important, but I think that um, I think there's a lot of things to consideration. So if you're a very rural and agricultural state, maybe it's the extension and the farm bureaus that you connect with most. Um, or if you look at some of the data and you can identify places where there's particularly low broadband access. Um, So if that is, in your state, a more rural area, that those are organizations who are probably really already doing some of that work. And so I think partnering with them can be helpful. I think understanding, those who are working in those areas. I think because you don't want to reinvent the wheel or you don't want to duplicate efforts around that. So it's an opportunity to provide an additional angle to really advocate for those greater resources. So if it's not solely, hey, it's important for broadband access because of these really now fancy tractors we have to harvest, and they need that broadband access because they have GPS in them. It's also, hey, this, our patients, our cancer survivors, our everyday people also need that to access resources. That can be something. I think that can connecting with the state broadband offices or related entities can be really important. Um, it may not be a long-term partnership per se, but maybe it is they know who else in your state or your area is really doing, work around broadband access. And so they're able then to connect you with those because who I have here is not in any way an exhaustive list. These are just ones that I'm more directly familiar with, but they might know then specific organizations who are doing efforts in this, or they might know, okay, this Chamber of Commerce, for example, I didn't put that down, but that could be another one if you're thinking more localized, because they're going to know, hey, if we have better broadband access, we're going to be able to, you know, perhaps have more businesses come and establish in our area, or and subsequently more people move to our area. So those are, just some examples, but I think the broadband office one, I think, will be really important to connect with, mostly to identify those organizations or entities that are doing this work already so that there's not duplication or that there's an opportunity just to collaborate or partner.
Yeah, so could you imagine this? Could you imagine seeing in community farmers and cancer coalitions like aligning efforts? So you
Yep,
have farmers for broadband. Could you imagine seeing something as beautiful
yep,
as that?
yes. That would be one. I mean, as a farmer's daughter who studies cancer, that would be wonderful. I think there's a lot of um, I when we think about advocating for policy change, I think diverse coalitions are really impactful. You know, or groups or coalition, whatever phrase we want to use. But I think recognizing that making policy changes or working towards a goal that affects diverse groups of people can also then thinking about the need for bipartisan support. Maybe that hopefully, hopefully cancer is bipartisan, but maybe not as always as often as we would like. But anyway, I think that can be really effective.
Basically, what I hear you saying is, think about who else this issue is important to and
Yeah,
who are those other potential benefactors
right.
from expanded broadband access. So, another thing you touched on were a list of various data, tools, and resources. Are there any tips that you could share in how programs or coalition can access data, or some key
Mm.
kind of tips and using the data to make the case?
Yeah, absolutely. So, and I had gone back and forth between opening up some of these data sources, but I ultimately didn't, just for the sake of time and switching screens. But a lot of these resources that I um, listed are some interactive maps. Um, and so that can be something where you can, download or pull data or, screenshots, maps of your state or, your county or other things. So um, I think maps can be really powerful to show that to, especially when you think about legislators or others who are thinking about their constituency groups or their um, district. And so when, because they're arranged geographically, so that geographic data can be really, I think, helpful to make that case. I think that uh, pulling some of this data to um, and presenting it in I think unique ways. A lot of times we'll say, well, 85% of the population has broadband access or whatever it might be. It sounds like a really high percent, but if we take that data and say instead that, 100,000 people in this area do not have access to broadband, that can be powerful. So I think using that data, um, and it's not that we're misrepresenting it. We're, those are the same numbers. You can say a percent who have it versus a number who do not. It's all based upon the same numbers, but I think presenting those data and again some of those stories in combination with each other can make a difference.
Absolutely. And you also talked a little about cancer care delivery and sharing health information and improvements to the care experience for patients as some of just the rationale for why this expanded broadband access is critically important. Can you also provide some examples in terms of how to frame this message about making the case for the integration of efforts to expand broadband access?
Yeah, that's a great question. And I think it ties to those stories. So maybe it is thinking about each of, some of those individual examples. So maybe it's talking about how that telehealth visit that somebody was able to do in April 2020 may have prevented somebody who was, you know, maybe they just needed to have a follow-up appointment related to, maybe they're doing their chemotherapy and they needed to have a follow-up appointment or something like that, or had just finished up and rather than going into the doctor when they're have the immunocompromised state in the midst of early part of the pandemic, they were able to have that telehealth visit at home, and that was facilitated by broadband access. So I think again talking specifically, some of those stories, some of those examples um, can be really meaningful. I think maybe a little bit of the challenge is, that tied to that broadband access, because, you know, this is all talking more one step removed from that. But I think those can be just some ways we think about how broadband access ties directly to cancer care. The patient portal elements, I know recently, a few years, the last couple of years, I know my dad had a colonoscopy and he was able to access the data through, define the results of that through his patient portal and screenshot it and send it to me. What does this mean? And I'm not a medical doctor, but I could kind of help interpret that. But I think, having that data available to patients or their family members or others, can 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 be another thing to highlight. And without that broadband access, that might have been a little bit harder um, to get, or maybe there's, that allows for that more instantaneous sharing of results versus something coming in the mail, uh, you know, a week later.
So definitely, thank you so much. So as we draw our webinar to a close, I want to extend our deepest gratitude to you, Dr. Zahn, for your insight today and your time. I also want to give a big thank you to all of our participants and for those most insightful questions. So definitely thank you to all of you. Just a few reminders. Just want to remind you that you will be getting a follow-up email, as well as there is a link in the chat to the actual evaluation survey for today's webinar. So I ask each of you, please, to take a few minutes, to complete that survey, because again, your feedback is is invaluable to us. So please take a moment to do that. As I was mentioning, you will get a follow-up email that will contain today's slides, as well as a reminder to complete the survey, or another link to the survey. But you won't need that then, because you're going to complete that evaluation survey today. So thank you in advance for your feedback. We also want you to mark your calendar for our next two webinars. The next one is scheduled for April 18th from 2 o'clock to 3 o'clock p.m. And that webinar is entitled Integrating Nutrition and Healthcare: The Essentials of the Food is Medicine Initiative. So mark your calendar for April 18th from 2 o'clock to 3 o'clock. Also, on May 4th from 12 to 1, we will have the Introduction to Built Environment Approaches for Addressing Health. So those are the next two webinars in our series as a part of our Tri-Network Cancer Prevention Community of Practice. So again, thank each and every one of you for joining us today, and we look forward to seeing you in a future webinar. Be on the lookout for that email with those slides, with the QR code for the survey, as well as some information regarding these next two webinars. So we will see you in a virtual space real soon. Enjoy the rest of your day and have a fantastic weekend. Thank you.